Hi everybody, this video of mine is about claustrophobia. Well, if you get very nervous or upset when you are in a tight place like an elevator or crowded room, you might have claustrophobia. It is an anxiety disorder that causes an intense fear of enclosed spaces. Some people get claustrophobia symptoms when they are in all types of closed up areas. Others only notice the problem when they are in certain cramped spaces like inside an MRI machine. No matter where claustrophobia pops up for you, you can overcome it with the right treatment. Now I'll tell you the causes. Claustrophobia is what psychologists call a specific phobia. That's a fear of certain objects, people, or activities. Fear of needles and heights. Fear of needles and heights, for example, are two other specific phobias. If you have one, the brain regions that are involved in the fear response are overactive. Your genes may play a role in claustrophobia. Researchers have found a defect in a gene called G6M6A that they suspect may cause it. If one of your parents has claustrophobia, you are more likely to have it too. Sometimes the fear of enclosed spaces starts after you have had a traumatic childhood event like bullying, abuse, being stuck in a tight place like an elevator. Having another anxiety disorder raises your chances of having claustrophobia. This means that if you are suffering from anxiety disorder, or if you have a generalized anxiety disorder, then you are more likely to get this type of specific phobia such as claustrophobia, which I am talking in this video. Any confined area can set off your fear, including things like elevator, airplane or subway train, tunnel, revolving door, car wash, bathroom stall or changing room, or if you are sitting in a car with automatic door locks. Just being in a room or a car with the windows shut can set off anxiety in some people. Now let me tell you the symptoms of claustrophobia. This is different for everyone. The anxiety it causes can range from mild nervousness to a full-blown panic attack. For doctors like us, to label the anxiety a phobia, the anxiety has to be severe enough to affect your ability to live a normal life. If you are inside an enclosed space, this can trigger symptoms such as shortness of breath, fast heartbeat, sweating, shaking, nausea, dizziness, and dry mouth. You may also feel a sense of doom, like you are going to die or the world is going to end. These feelings can be very frightening, even if you are not really in danger. And though you might realize that the fear is not rational, you may not be able to stop it. Panic attacks are intense and can last for 5 to 30 minutes. Along with shortness of breath and sweating, you may also have chest pain and tightness. These are also the symptoms of a heart attack. If you are not sure whether your problems come from anxiety or a heart problem, you should get immediate medical help. Now let me tell you the treatment. If you do not get treatment, you might find that you deal with claustrophobia by avoiding the object of your fear. You might stay away from tight places, taking the stairs instead of the elevator, or walking instead of riding the subway. You might scan every crowded room for the exits or stand close to the door. Some people, if their anxiety is severe enough, may be afraid to leave their homes. Avoiding tight spaces won't make your phobia go away. The first step in getting treatment is to see a psychologist or a doctor like me or any other mental health specialist. There are several types of therapies that can help. The problem is that people try to avoid these kind of places in which they feel that there is a danger of like claustrophobia, but avoiding these tight places is not going to help you. So you should seek medical attention, because the more you avoid these type of areas, the more symptoms you develop, and you are not going to be all right. Okay, just remember this fact. So you need help, and you should discuss all your problems with the doctors. Okay, now let me tell you, there are some options for the treatment. The first option is exposure therapy. In this, there is a gradual, we put you in a situation which is gradually like, gradually like your own fear. We are exposing you to that kind of fear which you are suffering. Okay, so what happens is that we usually show some photo of a tight space. This is a part of the treatment. It gradually puts you into the situation that frighten you to help you get over your fear. Okay, as I told you that we might show you a photo, so you can see a photo of a tight space. Then with our help or any therapist help with you are working, you work up to being inside a tight space. Okay, it's a sort of we are exposing you to these kind of situations, but we are doing it slowly, so you gradually overcome your fear. Okay, the next comes cognitive behavioral therapy, that is CBT. This is a type of talk therapy where you meet one-on-one with a trained therapist. You talk about the negative thoughts that drive your fear and learn ways to overcome them. You might get CBT alone or combined with exposure therapy. Sometimes the combination of these two therapies, exposure therapy and CBT, they really work very well with the patient. There's a new form of treatment that's known as virtual reality. This is a treatment that uses computer simulations of tight spaces like elevators or MRI machines. Getting the experience of a tight space in the virtual world can help you get over your fear in a setting that feels safe. If therapy is not enough, your doctor can prescribe anxiety drugs or antidepressant to help you deal with the situation that cause your fear. Well, there are some famous medicine, for example, propranolol, which is also known as Androl. This is the trade name of this beta blocker. Okay, so sometimes we prescribe this medicine to overcome your anxiety because it's a beta blocker, so it helps you calm down, and all the symptoms of anxiety are relieved with this medicine. Okay, but normally we do not recommend medicine, as I told you that we recommend exposure therapy and CBT and virtual reality. But sometimes when the symptoms are more and the patients are not treated with these therapies which I told you just now, then you may need drugs such as propranolol, Androl, which I just told you, and some there are some anxiolytic medicines like benzodiazepines we may also prescribe. But these anxiolytic medicines we usually do not recommend for longer time, because there is you may get some sort of addiction to it, and there is a drug dependence if you take these for a long time. You should also remember the sport is the key when you are trying to overcome a phobia. You must talk to your partner, other family members and friends. You can even ask them to come with you to therapy sessions. So this is very important. If you hide your fears, or if you try to avoid those kind of situations which put you in this claustrophobia, then these are not going to work. You should tell your problem. You should discuss your fears with your therapist, and you can involve your family members also. Okay. So if you are so afraid of enclosed spaces that it affects your daily routine, you should get help from a mental health professional. You can see a psychologist, therapist, or an anxiety specialist. Even you can see a GP. Okay, then he or she may direct to the concerned department, or he can also treat you well. Okay, with the right treatment you can learn how to control your response to situation you once feared. So I hope you'll have a good idea about claustrophobia. If you are suffering from claustrophobia or any kind of illness, you can discuss with me. You can write your comments in the comment section, and I'll try to make a video on your illness, or if possible, or if it's not possible to make a video, then I'll try to reply your comment as soon as possible. Okay.